I'm Christine Fellingham, and I'm back with another Monday Makeover. We're here again in the beautiful offices of board-certified cosmetic surgeon Dr. Julene Samuels. Dr. Samuels, thanks for having us here today.
Thank you, and thanks, Erica.
And yes, today we have Erica with us, and Erica's here to talk about some issues that many women face, and they don't talk about them. So thanks for being here.
Of course.
And you were turning 40, you had 3 kids, 2 very close together, and you found yourself dealing with a lot of issues that many women face.
Yes.
Can you talk to me about what was going on in your life?
Yes. I had gotten remarried, and we had 2 girls back to back, and within 22 months of each other.
Wow.
And when you're close to 40, your body doesn't have, I didn't have that time to recover and actually heal. And so I found out I was dealing with a lot of problems with my pelvic floor and not having that muscle connection. And so I needed to find a provider to help me reconnect. And the providers I was meeting with weren't really helping me. And a lot of the information they were giving me was outdated and didn't really apply to how I live my life and didn't seem like reasonable options for me.
Because you're an active woman, and I know you get out with the kids, you were walking in, you were finding yourself actually planning around having to run to the bathroom or run and change pants.
Quality of life had just plummeted. And I just had to compensate because I wasn't finding the answers that I needed. And I came across an article about the Emsella chair, and I was led to Dr. Samuel's office, and I have just had the most incredible results from coming here and meeting her and having a woman's touch.
With a non-invasive treatment that you are actually having right at this moment.
Yes.
So Dr. Julene Samuels, can you tell us what's happening here in this magical chair?
Well, it's kind of a mystery to me that more people don't know about this. I've published 2 peer-reviewed articles now on this in journals that are reputable. We have consistent data across the U.S., and I serve as a key opinion leader for BTL. What we love about this is we can take this as step 1. We can use the Emsculpt Neo core to floor, and we can also add vaginal rejuvenation devices and deal with not just urinary incontinence, but female sexual function issues following childbirth and weight loss. Erica's lost how many pounds?
72 pounds.
So you get all of that combined in a mom who's in her late 30s. And you have a constellation of symptoms, and we call that actually genitourinary syndrome. So we have the devices that can fix all of that now with or without hormones, no downtime, no anesthesia, no recovery time, immediate results. So it's time women knew about these options.
And this is non-surgical, and typically a series of how many treatments before you start to see results?
Patients start to experience results in 3 treatments. We do 6 total, and I serve on a committee with urogynecologists, well-established, respected urogynecologists across the U.S. who've also reduced the number of pelvic floor reconstructions that they're doing. And I think it's a combination of treatments that helps us do that, even for patients with some prolapse, grades 1 or 2 prolapse.
Which is where I believe you were, and how has this changed your life?
I've healed. I've lost my prolapse, and it's even taken care of my rectocele.
Incredible.
Yep.
So if this sounds like something that you'd be interested in checking out, please go to womenstouchmd.com to learn more. And I believe, Julene, you have some special offers.
Right. We're actually really excited about this and want to give patients a complimentary consultation and also 10% off package prices purchased from there on.
Wonderful. Well, thank you, Dr. Samuels. Thank you, Erica. And thank you for joining us for another Monday Makeover.